Nobody's really planning to go to the doctor to have a good time. I mean, they're there to seek advice, to have something done that may be unpleasant, and to discuss very personal and complex matters. So the whole impact of the environment, people become much more sensitive to their environment when they are anxious and concerned. So every detail of how that process begins, from how to find a doctor, how to find out where the doctor is, how you get there, who you meet first off, those first impressions. Is the doctor going to do the best job possible? Have I found the right doctor for me? Is this the best institution I can work with? The impact of that environment is very, very important to both the physician and the patient in feeling comfortable getting the right information. And if you don't get the right information, you won't get the right diagnosis and the right treatment. I think that revolution has started slowly, probably about 20 years ago, with a significant amount of research that began to show in a very clear fashion the impacts that the environment has on the outcomes of healthcare services.
How you been?
Oh, fine.
Good. So what happened?
I lost my insurance.
You lost your insurance. Well, that's happening a lot.
Well, I think we would all like the issue of insurance and how we pay for healthcare to go away. I mean, ideally, that's not what you want to be focusing on, but we have to understand that and make that work so that delivery of care can happen. But that's not the focus of what healthcare is really about. That does not relate to the experience of healthcare delivery and the experience of patients staying well, becoming well. So I think people equate those two things together, but they're not the same thing. And we do need to go beyond this issue where people say, well, we've solved healthcare if we've come up with a reasonable issue of how to deal with reimbursement and insurance. Well, believe me, we can do that, and we haven't solved healthcare. We haven't even begun to look at the nature of the healthcare experience, how to improve that, how to make it more efficient so it costs less, and how to get people on the road to wellness sooner so we have less acute care medical services being delivered without decreasing outcomes. Many people assume from my background as being both a physician and an architect that I can do it myself, that I have enough experience to sort of plan a hospital. Every facility is different. We have differences in cities, we have differences in regions, we have differences in the culture of that healthcare facility itself. So you need people who can speak various languages and get everyone to talk together. It is a huge spectrum from city planners, regional planners, city governments, federal government to state government. All of these areas regulate the healthcare environment. The regulations that any city or any university would have in a controlled environment, all the way down to our physicians and our nurses. And frankly, when I'm designing a room itself, one of the groups that I always talk to and plan with are the housekeepers, the people who actually have to maintain those environments. So we do the spectrum from, the President of the United States down to our housekeepers, and everybody's involved in the process. And they need to be involved if we're going to have innovation, because as I tell many people, I have a global experience from many different facilities, but I don't know much about that specific environment where that specific doctor or nurse or physical therapist is working. And they've been thinking about that environment for as many years as they've been working there, and I've been thinking about it for a relatively short period of time. So we put my broad experience and their specific experience together, and we get results. Healthcare is a huge sector of our economy. So there are many, many corporations who have a role in the healthcare sector, whether that be by manufacture of equipment or pharmaceuticals or many, many other groups. Plus, I think people are interested in supporting and disseminating information about wellness and healthcare. So there's a lot of reasons why people would have an interest. I think people also would have an interest in knowing that the public now can see what goes on and see what those relationships are and actually see what a corporation's role in that system may be. So if we're looking at groups such as a company that makes imaging equipment or radiology equipment, that's something that seems very, very foreign to the general public. In this way, they can see how that piece fits in the overall healthcare environment, how that is a specific environment in which design has changed people's reactions to it, been able to make it a less stressful experience, so that you can actually see how a product and product development works within the overall future technology and future improvement in the environment in which we work. So I think it's getting the message out not only from the physician and the nurse, but from all those other groups and potential sponsors who are part of that team that puts healthcare forward.